Hi guys, today I'm going to be talking about a super interesting and controversial topic about filler, which is filler longevity and filler migration. I'm gonna also be giving you some tips to avoid filler migration, so stay tuned till the end. So what is filler migration? Filler migration is when we inject one area and over time the filler moves from that area to another area of the face. People usually recognize that as the mattress lip. So you know when people get their lips overfilled and the filler starts to go into the top lip and forms that pillowy looking upper lip, and people get what we call duck lips. So that's usually what people think about when we're talking filler migration, but filler migration can occur in different areas of the face as well. Oftentimes it goes unnoticed. People have filler migration, they don't even know it, and it can happen even years after the filler was injected, it seems. Although it is rare, we can't really decide whether someone has had filler migration or not, because sometimes it's not apparent to the naked eye and you need further imaging to even see any type of migration. And you know, for the most part, it's not really a problem unless, you know, the filler migration is evident to the naked eye. Then that can look unpleasing. But here are some few reasons filler migration can occur. So a couple reasons I have listed right here. So high volume, basically having too much filler. When you inject a small area with a lot of filler, the filler needs a place to go. And although we're injecting in the lip, for example, there's no reason why the filler wouldn't be able to go into the upper lip if you overfill the area. The filler is going to go where there's the least resistance. So if we're filling the lips, but the lip is already filled with filler and it's saturated, there's nowhere for it to go, it's going to go at other areas where it can find space. Another reason why the lips is such a common area where we see filler, other than the fact that people are going kind of wild with augmenting their lips sometimes, is the muscle activity. So we use our lips obviously a lot to talk and stuff like that, and the muscle activity can make the filler shift from one area to another. Another reason would be poor technique. So if you were injected poorly, if you were injected and the lip border was not really respected, that can create again that lower path of resistance where the filler will be inclined to go. Another thing when we're talking about poor injection technique is injecting too quickly. If you inject too quickly, that can be a problem as well, or injecting into the wrong plane of the face. That can also lead to migration. One technique that gets a bad rap when it comes to filler migration is the Russian lip technique or the tenting technique. And basically it's a technique of lip filler where people get injected at the border going vertically up. And it's just one poke and people are going up this way. And the reason why this technique is being criticized by doctors and nurses that inject is because they're finding that those pokes that are created in a vertical manner encourage the filler to go up into the upper lip. So I've steered away from that technique, although it gives a nice result. There is a lot of criticism that has to go with it. Another thing about it is it makes the lips really flat and it just doesn't respect our normal anatomy. Our normal anatomy is pillowy lips, and this technique tends to flatten the lip. I like to respect the face, respect the facial anatomy, respect the tissue, and respect what it can and cannot handle. Another cause of migration would be to massage. So that is one thing I honestly hate, when injectors tell their patients to go home and massage their own lips. There's no reason for which the patient will need to go home and massage their own lips, but I hear it all the time. I hear a lot of my patients come in and tell me that their previous injector told them to massage their own lips. Don't do that. Really, there should be no need for massaging after you leave the clinic. I massage once in a particular motion, And that's pretty much it. I don't expect the patient to go home and massage. Again, the filler is settling into that area and we don't want to disrupt it too much. So don't go home and massage your own lips. And there's an interesting small study that Dr. Gavin Chan in Australia, I believe he is, made on YouTube, and he posted a video about filler and its longevity. He had a bunch of his patients that have had fillers in the past go get MRIs, and they found trace amounts of that filler. While not really problematic, it was interesting to see filler migration. For the most part, we can just dissolve it with hyaluronidase, which is an enzyme that breaks down filler. So before I continue and people get freaked out, I just wanted to put that out there. And I feel like that's one of the reasons why I probably don't see very much filler migration in my practice. I've got a couple of theories. First of all, a lot of the filler I do is for anti-aging purposes. So I'm just restoring lost fat or trying to support the tissue just a little bit with filler. Number two is I don't inject very large amounts of filler at a time, nor do I inject large amounts of filler in any given area at any given time. The other thing I like to do is I inject in hopes of restoring proportions or enhancing features. So I don't try to create a feature in your face that is not there. And I steer away from adding volume. Because if you're constantly trying to add volume, that's when you get into trouble. That said, when it comes to lips, especially in this day and age, we're trying to add volume. That's the only area that I do add volume, but again, I go about it in a safe manner. When we're restoring proportions only and we're just trying to enhance features and we're going in with that mindset, you get great results. That's another thing to keep in mind, is the product selection is very important. And if you're talking about people who had fillers 10, 15 years ago, the technology back then was very different. They've evolved to be better and to, go away with time. So when it comes to filler longevity, the answer is we don't know how long fillers last. And we do know that they may last longer than what it looks. And so that's one thing to consider. So when it comes to the recommended amount of filler per site, per facial site, whether it's cheeks, lips, chin, jaw, it really depends. Everyone's going to be completely different. Know that less is more, but also that if you want to get a good result, you kind of have to get something beyond just a 0.5 or whatever. And once you get to a satisfactory result, just coast on that for a while before you go back in and get more filler done. Another thing I want to really encourage is if your filler looks bad or looks like it's too much, dissolve it. Just dissolve it. Dissolve the filler. It's not that big a deal. You can dissolve your filler. It's not more painful than actually getting filler. Okay, so here are my tips on how to avoid migration, and this has worked for my patients 100% of the time. I don't have an issue with filler migration that I know of. Obviously, when we're talking about getting MRIs and seeing underneath the skin and seeing if there's residual filler from, past filler, I can't talk about that because I do not get MRIs for my patients for filler. But on a superficial, not looking poofy type of note, here are my tips to avoid filler migration. Number one, plain and simply, don't do too much, don't overfill. So that's the other thing I like to recommend to patients that kind of get carried away is look at your before photos, look how far you've come, and don't chase a specific result per se. I like to remind people after the first time they got filler, after the first time you get filler, you're so happy, you're like, whoa, that's such a drastic result, that's so beautiful. People fall in love with it. And then they forget. They forget what they used to look like. And so don't get carried away with getting too many syringes at once. That said, I know Dr. Gavin Chan in his video, he talks about using one syringe for the whole face. Personally, I don't agree with that. I don't agree with that at all. I feel like if I did use a single syringe on someone's full face, they'd be very, very disappointed. I think it's better to play it by ear and use the right products. Number 2, don't do too much in one area. So respect the tissue, respect how much the tissue can handle, and that is up to your injector to decide, but also look at yourself. A good indicator to know if you've had too much filler is if people can notice. If someone can notice that you've had filler done and it's been a couple weeks since you've had the filler and the filler has settled, that's a pretty good indicator that you need to stop there. Filler is supposed to be subtle. It's supposed to enhance and restore your proportions. It's not supposed to be noticeable. And I like to think that majority of my patients, you can't really tell they've had anything done at all. Maybe the lips, again, because of people loving that volume. If someone can spot the filler, no. It's not good filler. Another tip is not to do too much in one sitting. For example, when it comes to lips or under eye filler or tear trough filler, I never do more than 1 syringe in one sitting. I will never do more than 1 syringe in one sitting. Again, we need to respect the tissue. We need to give the tissue time to A, absorb, and B, we don't want to overload it and push the filler in different areas. And my last tip is just know what product you're getting injected. So I always tell my patients what product they get injected. I'm sure majority of the time they probably don't remember, but we have it on file. If they ever need to call and know what type of product they got, we know what product they have in their face. But it's really a good thing to know. It's important to know what you're putting into your body. So if we're injecting filler and I'm letting you know, hey, you're getting Revanesse Ultra, make note of it, just so that you have that information. I have tons of patients coming in and they've had fillers in the past, and I ask them what filler they have and they have no idea. But I need to know, especially if we're diving into beyond hyaluronic acid, because right now I'm talking about hyaluronic acid fillers, but a while ago, a lot of permanent fillers were being used, semi-permanent fillers were being used, and as an injector, it's really important for me to know what kind of filler you have. That way I can go about injecting you safely. I really hope you guys enjoyed this video. This video was not to deter anyone from getting fillers. Fillers are super safe, but this was just a topic I do get asked a lot about, and I want to make sure that people make informed decisions. If you have any questions, please leave them down in the comments below. This is definitely a tricky topic, and we just need more studies in the aesthetic medicine field. But anyways, please like, subscribe, and I'll see you guys in the next video.